Good afternoon, everyone. My name is Hamera Osman, and on behalf of Muscular Dystrophy Canada, I am very happy to welcome you to our second webinar from our new series, Let's Talk NMD, Let's Talk Neuromuscular Disorders. Before I introduce today's topic, I would like to mention that we have muted all participants, but I welcome you to type any questions or comments throughout today's session in the chat box. We have also allotted time at the end of today's webinar for a live Q&A. At that time, you can use the hand raise button and we will invite you to share your experiences, comments, or ask questions of our speakers. Please note that a recording of today's webinar will be available by the end of this week on our MDC YouTube channel. With that said, let's get started. Today's weekly webinar is on mental health. As an organization that represents over 160 different neuromuscular disorders, we recognize that mental health, mental and emotional well-being is important. In fact, it's well documented in the scientific literature that neuromuscular disorders have a high symptom burden and can be frequently associated with many adverse psychosocial outcomes, particularly reduced quality of life and emotional well-being. The Neuromuscular Disease Healthcare Provider Survey indicated that approximately 75% of people with neuromuscular disorders have some level of psychological symptoms, and this is recognized as an unmet need for patients. With the recent COVID-19 pandemic, and depending on how long we're in the suspended state, we anticipate there is a critical need for managing stress, anxiety, and our emotional well-being for people with neuromuscular disorders, caregivers, advocates, allies, and healthcare professionals. We are very grateful for our fantastic lineup of speakers, and in advance, I'd like to thank you for your time and expertise. I would like to ask our CEO at Muscular Dystrophy Canada, Barbara Stead-Coyle, to share her message on the importance of mental health at MDC.
Great, and thank you everyone. It's truly a pleasure to be able to join you here today for this second webinar in our series. And thank you to all of our clients and family members who have chosen to join this series. I would continue to invite you to send us your ideas for other topics that you would like us to cover in the coming weeks and months. But of course, our emotional health and our mental health is just as important as our physical health. And so we're very happy today to bring this topic to all of you. And again, I would echo thank you to our speakers who have given so graciously of their time.
Great, thank you, Barbara. So now we have Dr. Amaria. Dr. Amaria is the Senior Clinical Director at CBT Associates. She provides treatment for children, adolescents, and adults with anxiety disorders, depression, adjustment difficulties, parent-child relational difficulties, and other health and coping related problems. As part of her interest in community outreach, Dr. Amaria is involved in supporting patients, educators, and caregivers on a variety of topics related to general child and adolescent development, mental health in children and youth, social skills, and risk-taking behaviors in adolescents. Dr. Amaria is a member of the College of Psychologists of Ontario, Canadian Association of Cognitive Behavioral Therapists, and the Ontario Psychological Association. Welcome, Dr. Amaria.
Great, thank you for that lovely introduction. So I am very grateful to be here. As a psychologist, I obviously have a bias about wanting to make sure people are taking their mental well-being seriously in the time of COVID. So I'm really going to spend some time talking a lot about sort of stress, anxiety, and uncertainty on our brains, as well as some of the things that we can do to support this. Because we've all been hearing a lot about the new normal in the past few weeks. And it doesn't look the same for everyone. There are definitely still things that we can all agree are present. There are going to be higher than usual levels of stress, anxiety, and uncertainty. Now, don't forget, we've all coped with stress and anxiety in our past already, before we even knew what the word COVID was. And that meant most of us also probably lived with some uncertainty also. And uncertainty really is that feeling of not knowing or not having control over our lives or our futures. So I'll start by spending some time obviously reviewing the signs and symptoms of stress and anxiety, as well as those tips and strategies that we're going to use to manage. But I wanted to start with a bit of the science behind this all and the roles our brains play. So go ahead, Omar, you can advance for me. So the first thing I want everybody to remember is stress is just the name for what we experience whenever we go through our change. go through a change. So in our normal lives, we all face stressors, and often when we can cope with a stressor really well, that is what makes us more psychologically resilient. The great thing about human beings is we do have a really good built-in sort of stress response system. However, it's mostly designed to deal with changes in our environment that are deemed dangerous or threatening, something we need to deal with quite quickly. Most of us will understand what the fight, flight, and fear response system is all about. We are lucky that it is present in humans because it activates when we have a threat or danger around us, and it is what allows us to survive those types of threats. And when the body is switched on, when we have that hormone of ACTH activated from our brains into our bloodstream, our bodies do some really amazing things to be able to prepare to run away, to prepare to fight a threat, or even just sort of freeze in the middle of all this. However, as you can imagine right now, our new normal, life with COVID-related stressors, includes so many different stressors and threats. I've listed just a few here. For example, social isolation, financial challenges, the difficulties balancing work and life, the health scares that we're all facing, and the general information overload. When we start to have stressors like this that are ongoing and chronic, our bodies are sort of responding in overdrive, even when all of these are not life-threatening. The one thing to recognize in all of this, in addition, is that human beings are really good worriers also. We have this incredible ability to think about and plan for our future. The good thing about that is it helps us prepare for things that we cannot control sometimes. However, when we have difficulty managing the balance between healthy planning or worrying and catastrophic thoughts about the worst case scenarios, once again, that stress system is activated. Unfortunately, the thing about most of the COVID-related stressors is they are about our futures. They're about things that are quite ambiguous, things that are, often open to different interpretations. They're stressors that are novel and new, so we don't really have a lot of previous experience to fall back on. And they're unpredictable. We don't really know how things are going to turn out just now. And unfortunately, those are the worst types of stressors for our bodies to deal with. So how do we know if ourselves or others are having sort of what we would call a chronic state of arousal? So go ahead, you can advance to the next slide. And these are some common signs of stress overload. Now I want you to recognize, first of all, that these are just some examples of the different signs and symptoms that people experience when they're having increased stress and anxiety. And if you notice, they fall into 4 different categories. So there are cognitive, emotional, physical, as well as behavioral. The really common cognitive signs and symptoms of stress overload are difficulty focusing, finding yourself worrying a lot, having trouble making decisions, or memory problems can be part of this. Emotionally, we often feel heightened levels of irritability or anxiety or agitation. We can start to feel quite low and depressed, hopeless, helpless, just generally unhappy. We might have a real inability to relax or feel a lot of restlessness at the same time. In terms of physical symptoms, headaches, muscle tension, physical pain, discomfort, stomach problems, as well as changes in our energy level and our heart rate. These are all signs of physical symptoms of feeling overly anxious. And then, of course, there are the behavioral changes. And these include changes in eating and sleeping, changes in your social behavior, withdrawing from others, as well as, use of other substances in an unhealthy way. And commonly, inability to do things in a productive way, so difficulty completing tasks at hand. So once again, I want everyone to remember that the reactions to COVID-related stressors are really going to be varying by person factors. So your underlying level of resiliency you have, the supports that are around you, the type of word style you tend to use, as well as how long a stressor is around and lasting. And also by factors we just can't predict yet. Remember, these are just common signs of a stress sort of overload, and we can all respond in different ways to COVID-related stressors. And we probably have responded to in one way or the other since the beginning of all of this in our lives just now. You can go ahead and advance the slide. Now, the real importance of recognizing those signs and symptoms is being able to determine you need to do something different, really to be able to be a sign that it's time to manage your stress levels better. So I've started with just a very short list. I know that all of the speakers today are going to be providing some great tips and strategies, but I wanted to sort of remind people about why and how we might really manage our stress levels. The first thing I'm going to remind everybody about is that the importance of activating our relaxation response. So when I talked about the flight, fight, freeze response and that chronic arousal, that arousal that happens in that moment, you remember the last time you felt very fearful about something. Your heart beat fast. You may have felt sweaty. You would have had an inability to focus on anything else. That arousal is quite uncomfortable, and our bodies are not designed to stay in that state for long. However, when it's kind of like chronic or underlying arousal, we need to fight it a little bit better. We can't just remove the threat, but we can activate a relaxation response. How you choose to relax, of course, is up to you. There's lots of different methods, tried and true methods, to be able to try and bring that stress arousal down. The next thing I remind people of is a bit of self-awareness around your worry style. It is really important to think about, what are those thoughts in my head that I'm having right now when it comes to worrying about my future? And see if you can take a better control of that. Because there are real problems that we can solve right now, and there are plenty of hypothetical problems, the ones that we can't quite solve yet. And so knowing your different worry style might also help you manage some of your stress levels. And there's some great strategies you can use to put worries out of mind. The next piece that's kind of important in all this, and there's so many great tips and tricks out there, but is really the importance of trying to find balance to manage your stress. So that's balance in your relationships, balance in your work and life balance, balance in the expectations you put on yourself, and finally to do this in a way where you connect with meaning. The idea behind connecting with meaning means that during this sort of complicated time that we're making decisions that are based on our core values, not somebody else's. And this means essentially, paying attention to the should statements you might be putting on yourself and self-judgment about what you expect yourself to be accomplishing or feeling during this time. People who connect with meaning are more protected from stress and generally more resilient overall. And finally, I encourage you to determine how you would build resiliency. The idea behind this is there are lots of competing activities just now, but as a psychologist, my bias is on committing some of our time to our emotional well-being and our minds. I think just as right at the introduction, our physical health and our mental health both matter. And this is why I'm really excited to introduce you one more tool that's out there. Mary, you can go ahead and advance the slide. Within our company, we've launched a new program called Stronger Minds. It's a completely free program. It's a digital program, so it's accessible across the country for all Canadians. And the idea behind this is really about building some skills to support and protect your mental health as we deal with the COVID crisis. We don't have the exact answers of exactly what we're going to include in this because we're really trying to be responsive to the needs of Canadians as they emerge. But we are going to be providing videos and reads and even activities to help people gain resilience. And I'm really excited to be able to figure out, what my role is as a psychologist to try and support people who are dealing with stressors, the stressors you're dealing with this week that we can work on, as well as the stressors we don't quite know how to deal with just yet. Go ahead. Thank you very much. I've included some other slides as well. I think they may be on the next slide, just with different mental health resources in Canada. I think this will be available to everybody. Again, we're very fortunate right now. There are lots of great tools out there to understand and learn about how to really care for ourselves in this time. So thank you for your attention.
Thank you very much, Dr. Amaria. That was excellent. Next, we have Dr. Kati Kamkar. Dr. Kamkar is a clinical psychologist at the Centre for Addiction and Mental Health, CAMH, which is Canada's largest mental health and addiction teaching hospital and one of the largest research centers in Canada. She is an assistant professor within the Department of Psychiatry at the University of Toronto. Dr. Kamkar provides evidence-based assessment services, independent medical evaluation, disability management services, and evidence evidence-based psychological treatment for mood and anxiety disorders, trauma and stressor-related disorders, including PTSD, occupational stress injuries to first responders, and on psychological distress in the workplace. She is a member of the Ontario Psychological Association, Canadian Psychological Association. Interestingly, she was a medical practitioner for the Invictus Games launched by Prince Harry in 2017 here in Toronto. Dr. Kamkar is an executive director for the Canadian Association of Fire Investigators and regional director in Ontario. I mentioned to Dr. Kamkar that firefighters are incredibly important members of our neuromuscular community here in Canada, as they have supported Muscular Dystrophy Canada since 1954 with fundraising and outreach initiatives. Welcome, Dr. Kamkar.
Well, good afternoon, and thank you so very much. Important topic. Certainly, with the COVID-19, what we witnessed, and pretty much globally, it has changed very much drastically. And of course, following that, we have noticed an increase in mental health concerns in a range of emotions that people have gone through. And in fact, any mental health concern they report in terms of the mood having changed. So cover, and I know my a colleague, Dr. Amaria, did a wonderful work at covering some of the main umbrellas, and I would like to echo that. Yes, as a result of having pretty much everything being shattered drastically and suddenly, and we're talking about ideally routine, ideally activities, concerns in terms of employment, finances, having to juggle at times maybe multiple things in the household, childcare, support for elder care, or at times it could be also boredom, and of course the fear for infection, not only to self but to others, and the quarantine and self-isolation, and the constant news. So of course it is enough for all of us, for our this inbuilt alarm system that we all have, the flight and fight response, to become really activated. And it's actually very interesting because also people do report a sense of kind of feeling scattered, that their concentration is not always the same. Is that also people thinking that people, oh, you know what, I have to work from home and I thought I would be maybe more productive. I don't have to deal with commute, but I do not understand why everything takes so much longer. And that's very normal. More people than not, in fact, have experienced that. It is because this inbuilt alarm system, with all the threat and the worries going on, we have failed this kind of slowness. So a variety of emotions, very much it could be sadness, feelings of anger, the anxiety and the fear, range of emotions that we all go through. And the reason why I'm mentioning that is the importance of normalizing them. There is at times our tendency to become even afraid, of our range of emotions. And people also say that they feel guilty over not being able to engage in their previous activities and responsibilities. So again, here important. So not engaging in, and especially self-kindness during this very difficult time. The anxiety that we are experiencing, and of course followed by all the worries and all the what if questions, very normal again, because of all the uncertainty. I think the COVID-19 is also, we can definitely also see it as a grief, and grief very much ranges on a continuum from, include, I miss going out, grabbing my coffee and my newspaper, going to the office, or just, wearing my clothes, to the other range, which is the death of loved ones, or the death that we are hearing and the losses. So that's also the way that we can definitely see it. So the number one is really around normalizing our reactions, the range of emotions and a range of thoughts. That's very key in reducing our fear of all the normal reactions. Two, it is really about keeping in touch. Of course, yes, we do feel isolated. We are isolated. We feel lonely, of course. At the same time, is also using our technology, because we are physically isolated, but also not socially. It is true that we might at times miss that human touch that biologically, of course, we all need. But it is here really focusing on, what do I have control over? Thankfully, compared to, again, 20, 30 years ago, we have the technology. And I would say to everyone, keep in touch as much as you can, ideally once a day, however you want. It could be emailing, texting, FaceTime, whatever app that you want to do. But it is important for us to keep in touch and using quality support, seeking help, asking for help, but then also around providing help to others, checking in on others. There are a variety of apps as well that people use to be still involved in the community, but also as part of their self-care. So here, the third thing is really around, how do you be creative and engage in very meaningful projects? So sometimes, it could be, people say there are some free apps now people can join. It could be for engaging in yoga. It could be engaging in stretching exercises. It could be in cooking, anything that we want, but it is still be engaged and be connected. The other thing is really around, how can we manage our thoughts? Of course, with a lot of anxiety and a lot of the thoughts around what if, there is a tendency at times where we might overestimate threats going on. So it could be that if I go outside, I might die, or am I never able to regain my work back, or the life that I had back. So it's really around, how can we best control the what if questions, and catching them early would be the best helpful. So soon as we are able to manage and catch the first what if and say, okay, let me take a step back here, and how can I reframe my thoughts? When we reframe our thoughts, it's really, we don't want to go from a negative thought to a positive thought either, because positive thinking might not always be realistic, but it's really around, how can I balance my thoughts about, okay, what is the probability of this occurring? What's the evidence for that? And how also can I look, what are the things I have control over? And I would say, I always say life is about details. Focus on the details. It's also around identifying our positives and expressing gratitude. Examples include, I'm able to go outside, enjoy the fresh air, practicing physical distancing as well, but I'm able to feel the air touching my face. I'm able to see the wonderful trees. I'm able to listen to the birds. I love those colors. So these are the things that, of course, we do not want to take, we don't want to take for granted for granted. And those examples also tap into what we call grounding techniques that I want everyone to start using. It's really around, how can you focus on the here and now, the moment, the present time? And it really revolves around senses to ground ourselves. So examples, as I mentioned, about the air touching my face. So the senses is really around, what do I see? What do I hear? What does my body touch? The sense of smell and taste. So for example, when we're having a meal, we want to get connected to our a sense of taste and smell. Whenever we are working on something, we want to feel the actual present time. Whenever you're walking outside, you want the birds or the flowers, or smelling the flowers, etc., etc. And so these are the skills that we can really use throughout our day to really also focusing on what we have control over, but then also the positives that we have. And it also helps to reduce some of the rumination as well. So especially if you notice that there are some locations or time during the day that you tend to ruminate, then I would say change the location, change the time. So, but awareness before that becomes very helpful. Now, of course, everyone's experience is very different. So some people are tremendously affected in terms of employment and financial concerns. So here, once again, focusing on what we have control over, the current worries, which are the current problems, potential worries are worries that right now do not exist and might not become true. So focusing our time and energy to current worries. So Of course, relying on credible sources, reliable sources for any employment and financial concerns, very important. For others who have to, juggle multiple things all at once at home, it's really how can we prioritize responsibilities and be kind to ourselves. There is a slowness going on, and that's okay. It's part of being human. That's again the self-compassion kicking in and working our best. There was a funny cartoon that I saw the other day. There was this little boy opening the closet door and say, "Oh, I found mommy in there." That's again multitasking, right? So again, prioritizing responsibilities, and sometimes there might be a need to isolate within the isolation if there is again too much going on around the house. So delegating tasks and prioritizing our activities. Going back again, in terms of the kindness and the self-compassion. So yes, you want to identify how you feel, your thoughts, but not in a way that to judge yourself or to become immersed in yourself in them. It's really around practicing mindfulness, where you can essentially perceive yourself as an outsider and be able to really use your thoughts and your emotions and put them into perspective and reframe them so that they become a bit more balanced. And as I mentioned again, self-kindness, reducing any negative self-thoughts, and of course realizing that we all human and no one is perfect. I always also encourage people to use what we call the 5-minute rule. So of course here as human beings, we all know we function best whenever there is a routine and structure. We need to engage in a routine and structure every day. Probably here right now we all know it's a new routine and structure, and that's fine. There's a lot of trying. You're gonna have to find your own individualized approach. I don't always necessarily agree, with a lot of things out there. They say, walk 60 minutes outside or wear your clothes every day, so I would say I always advise everyone is really find an individual that works for you. Obviously, healthy diet and exercise, exercise in however shape and form that you want, very important. We do know intense exercise or deep breathing, including healthy diet, have a direct relationship on our health. When I say health, I'm talking about mental health and physical health. There's always the mind. Finally, I would like to leave it out with 2 things. The first is 5-minute rule. Some people say a 2-minute rule. If you have difficulty initiating an activity, say to yourself, you know what, I'm going to do in 5 minutes. If it doesn't work, I'm not going to pursue it, but I'm going to do it 5 minutes. And sometimes even the night prior, it becomes helpful to just, if your goal is to read this chapter, take your book the night before, open the chapter. So tomorrow, when you have it visually ready, it becomes tremendously helpful. And what I want really everyone to know, yes, there is a light at the end of the tunnel. There is a light. It is true. We do not know when this is going to end, which add to the uncertainty. But uncertainty is not always a bad thing. It's not always associated with something unpleasant. Let's remember that there is a light at the end of the tunnel. And in the end, there will be the psychological growth. There will be the personal growth. And it will be part of your own individualized resiliency that you will be very proud of. Thank you for having me.
Thank you very much, Dr. Kamkar. Next, we have Scott Jansen. Scott is a clinical social worker and a member of the Motivational Interviewing Network of Trainers at Nova Scotia Health Authority. He has been working in the field of problematic substance and process abuse for 30 years and has practiced in his home province of Alberta, the Yukon Territory, and since 1998 for the Nova Scotia Health Authority Addiction and Mental Health Program in Halifax. Since 2007, Scott has been a clinical practice educator, providing staff training and coaching and development with an emphasis on motivational interviewing. Scott completed his motivational interviewing the trainer in 2006 and an adult education certification. Welcome, Scott.
Well, thank you very much. And thank you everyone for letting me be a part of this panel. I just want to congratulate the first 2 speakers. That was wonderful. Next time I do this, I want to go first because that's a hard act to follow. So in the 10 or 15 minutes that we have together, there's a few things I want to kind of get covered, and I'm going to go through some of them fairly quickly because they were covered very well already. But in our short time that we have together, I just want to talk a little bit about how to manage stress and anxiety, obviously. And it's also applied to children, youth, and adults. So I'm going to try to blend those 2 together as we have our discussion. And at the end, I want to just kind of introduce a program, an online program called Therapy Assistance Online. So to start us off, whenever I do one of these talks, I like to bring in Plato. The greater part of instruction is being reminded of things we already know. No one who's paying attention or participating in this panel discussion should be falling out of their chair about anything that we cover today. But it's amazing what I know when I'm nice and relaxed and calm are the same things that I forget when I'm under a lot of pressure. And as a society, we're under a lot of pressure right now. So I think one of the best things to do is let's remind ourselves of the things we already know so we can get back on track. So just some guiding principles to keep in mind. And again, I'm going to go through these fairly quickly. First of all, feelings are normal. That's already been touched on. The reason why we spend a little time talking about that is feelings often get put into one or two camps. There's good feelings and bad feelings. The reality is feelings are just feelings. Feelings are our mind's way of telling us there's something that needs our attention. And yet, if I set something up as, or define something as a bad feeling, there's a chance that I don't want to talk about it or address it. I want to try to numb it out and somehow. Feelings are normal. The good news is, even though we can't stop feelings, or sometimes can't stop the thoughts, we can have more than one feeling and a thought at the same time. And one of the things that I want to talk about in the next couple of minutes is the ability to water down those uncomfortable feelings and thoughts, not by stopping them, but by adding to them. Stress gets a bad rap. It does. Stress is there for a reason. And it's a good thing we have it. Stress, and again, using COVID-19 and what we're going through, stress is what helps me remember to wash my hands as much as I do. Stress is what helps me remember to adhere to the social distancing policy. Stress is there for a reason. Stress is what makes me look both ways before I cross the street. What we're talking about today isn't necessarily just stress. And I think everybody probably already gets this. What we're talking about is distress, accumulated stress, chronic stress. There's different terms to add to it, but this is above and beyond the normal stresses that people often face. We are doing a in-class presentation. I often talk about, it's not necessarily about the amount of stress, but how long we hang on to it. So if this was an in-person presentation, I'd ask for 2 volunteers to come up. I'd give each volunteer a styrofoam cup filled with water. And I'd ask them to stand side by side, hold onto the water with their arms extended. After 15 seconds, I'd ask the first volunteer to put the water down and ask them, how does their arm feel? They, of course, say, I'm fine, arm's okay. The second volunteer, I would say, that's great. We're going to get back to you at the end of the day to see how you're doing. I don't usually do that because I don't want to get sued. But the point is, we often put a lot of stock into how much stress we're facing. I want to add to that. It's not just the amount of stress, it's how long we hang on to it before we give ourselves a little bit of a break. I also want to talk about how stress and anxiety management is very individualistic. So Tom Cruise and I are the same age. Now, unfortunately, that's the only thing that we have in common. Tom Cruise is well known for doing his own stunts in his movies. He's well known for having a very active lifestyle. He climbs mountains, he jumps out of airplanes, he flies his own airplane. Those 3 things that Tom Cruise, and I'm taking a bit of a creative license because I don't know Tom Cruise, but those very same things that I think that he finds as exciting and relaxing and a healthy distraction from the day-to-day stressors, they're the very same things that cause me a lot of distress. Personally, I decompress by going to a beach and reading a John Grisham book. And again, I don't know Tom Cruise, but I wouldn't be surprised that if Tom Cruise sat on a beach for 3 days reading John Grisham, his anxiety and stress levels would actually start to spike. My point is simply this. Everyone has a unique stress type. If you're looking to get everything you ever want to know from an hour panel, you're not. This is an invitation to look at things that apply to you, but also to recognize that every person listening is an expert on themselves. Take some time, review what you know works for you, and get back at it. And the last point is, often it's not the stressor itself that causes the most harm. It's what we do with it. Now, for the last 30 years, I've worked in mental health and addictions, and it's a pretty straight line to see how people have really unhealthy coping mechanisms. People have stressors in their life. What do we do to deal with them often has a greater harm than the stressor itself. We are now faced with a very stressful time in our society. Again, the question I have for anybody listening is, what are you doing to take care of yourself? Is it adding to the stress in the long run, or is it a healthy coping mechanism? And again, being the expert of ourselves, that question is something that probably only you can answer, or people who know you well. Take the time to find out. Next slide. Now this slide I'm going to go through rather quickly because it was already covered so well. But I just want to point out that the origin of stress was not from physiology or biology. Actually, it's an engineering term. It talked about the amount of pressure or strain placed on material. But it seems like it's a good fit for what we're talking about today. And it was adopted quite a while ago as it applies to human beings. The stress that we're referring to today, oops, can you just go back to that previous one for a second? So the stress that we're referring to today, and I already talked about this, isn't your normal stress. This is the distress. Anxiety, again, can be simply thought of unhelpful thinking patterns we experience when our minds fixate on threats, uncertainty, and negativity. My point is simply this: we often lump those two terms together, stress and anxiety. Stress often or typically refers to the physical part of it. Anxiety refers to the cognitive part. Both are connected together. We often talk about the mind-body connection. And I often use the statement, it's difficult to have a stressed body and a calm mind. And it's difficult to have an anxious mind and a relaxed body. So when we talk about anxiety and stress management, there's two fronts that we can look at. One, physically, and two, cognitively. And obviously the best one is when we combine the two. Next. So let's start with anxiety. The first one is talk. Again, Plato had it figured out a long time ago. The things that I know when I'm feeling calm are the things I forget. The very times when it'd be beneficial for me to start reaching out to people are often the times when I isolate. And I don't mean just physical isolate. I mean having those people in our circle of support that don't get accessed. And by talking, I don't mean just the normal. Most people in society have really good communication skills. We talk a lot about stuff. What we're not so good at is developing an emotional language. It's the ability to identify and talk about what we're feeling that acts as a bit of a pressure release. We're communicative beings. We get our needs met through our communication. And if I don't have a strong emotional language, a lot of times I don't get my needs met. And this, again, I'm going to bring back to children and youth. If most adults aren't good at using an emotional language, it's even harder for children and youth because they've had less time to practice. What I mean by that is, think about some of the times in your life when you asked somebody how they felt about something. There's a good chance you didn't get an emotional response. What you got was, well, I feel like. Typically, people talk about a situation versus how they actually feel about it. So if we're talking about a pandemic, well, I feel like this is going to go on forever. I feel like I'll never get to see my friends. That's not a real emotional response. When I ask a child, well, I feel like I never get to see my friends anymore. Sometimes we have to add a little emotional language for them so they get that point across. Yeah, it's an awful lonely time for you right now. People in general do not have a strong emotional language. My point is simply this: practice. Practice. What are you feeling? Another strategy is looking at our information diet. And I love that term. It's not mine. I picked it up, but I do like that term. How are we feeding our minds? One of the other speakers already talked about how part of our natural defense mechanism is to be worriers. And we're that way for a reason. We're naturally pessimistic. That's what keeps us safe. Again, my pessimism helps me look both ways before I cross the street. I don't take for granted nothing's coming. I will check. The problem is I can overdo it. So on the news, and the media is already aware of this, they know that fear sells. Their intent is to get viewers. Fear sells. If you look at any or most news programs, 90% of it is based on fear and threat, because that's what tunes people in. That's what hits our radar. Our radar does not go up when things are going well. Our radar goes up when there's a perceived threat. The downside is if the only thing I'm feeding my cognitive self is a steady diet of threat, it's no wonder why we start to have spikes in anxiety and stress. What I ask people to do is seek out for yourself some breaks in that. Find the good news stories in that. There's a lot happening out there, and the human capacity is amazing. Look for some of that. I'm not saying bury your head in the sand. Information's important. But again, having a healthy balance between the two. It's really easy to gorge on threat. Another strategy to manage anxiety is something that I don't think people often do. It's a personal strength inventory. We're very good at identifying our own gaps in ability and working on that. And that's okay. That's important work too. Again, I'm asking people to add to that. Everybody listening in, from Alberta to PEI, everyone listening in somehow since the day you were born managed to make it to this point in time. That doesn't happen by accident. We have strengths, we have abilities, and it often gets overlooked because being pessimistic, there's a tendency for me to keep my radar open for what's not there. Take a moment. It takes 10 minutes. Put pen to paper and do a personal strengths inventory. It goes an awful long way to calm because it gives a sense of hope and ability. The last one under the managed anxiety category is the thought stopping versus thought amending. We spend a lot of time talking about thought stopping. It's hard to stop a thought. It's much easier to add onto a thought. So people can turn themselves inside out. I have to quit thinking about this. I have to let this go. I have to quit doing whatever. That puts a tremendous amount of pressure on ourselves. What would happen if you allowed yourself to have the thought, but add to it? And I just used just a basic example, and some of it's cut off there, so I'm going to try to remember what I wrote. So this social isolation is taking forever. I don't think I can manage much longer. If my thought stops there, it's really no wonder why my anxiety goes up. It's a threat-inducing thought. What would happen if I had that same thought, but I added on to it? The social isolation is taking forever. I don't think I can manage much longer, but I've had other challenges in my life and got through them, so I'll get through this too. We often forget about the talents and abilities that we have. My job, often as a therapist or a trainer, is to help people be reminded of things they already have. Brings me right back to Plato. It's amazing what I forget during times of stress. And strengths and ability is one of them. So let's switch over to stress, the biological stuff. We had two very competent speakers talking about this. I'm not going to spend a lot of time on it. There is a plethora of behaviors and strategies out there to deal with stress, and they're all good. Don't get me wrong. Practice a few things, find out what works, what doesn't work. I would encourage people before you get to the how you can do things different, take a little time to examine the why. Why would you even bother? Everybody has their own reasons to do something. Answering the why provides the motivation to move forward and to do the actual strategies. As clinicians, and I'm speaking in the I have a tendency to work with somebody and I jump straight into that action stuff. Here's what you can do to make things better. Two things. First of all, people don't like being told what to do, even if they're good ideas. And two, oftentimes people already have that information. It's not a lack of awareness that stops most people from doing the healthy things in life. There's something else going on. It's the motivation. I know this stuff, and we can spend a lot of time going over stuff that people already know. What I encourage people to do, again, put pen to paper or have a conversation with someone. Why would you even want to do this? What's in it for you to manage your stress? What's the outcome for you that you're looking for? People usually have a good handle on how to do something. Spend a little time on the why. Take a little time to identify the current unhealthy or short-term coping mechanisms that you already have. You're the expert of you. Take a little time to examine what's worked and what hasn't worked. Borrowing from the self-help community, They use an acronym, and again, this isn't just for the self-help community. Anybody with a heartbeat can benefit from this. The acronym HALT. It stands for hunger, anger, loneliness, tired. Hungry, angry, lonely, tired. It's a nice foundation thing to hang on to. Write it down, put it on your fridge, keep it someplace close as a reminder. Remember, stress gets intensified if I don't take care of myself. Eat healthy. Don't allow yourself to get hungry. Don't fill up your fuel system with just junk. Take a time to keep yourself strong. Angry, resentments, they go a long ways too. People can get resentful about living during a time of a pandemic. What do you have some control over? Lonely. Yeah, we're in a time of social isolation. At the same time, we also live in a time where we have media that we can reach out to people quite easily. I've had clients tell me the loneliest they've ever been was when they lived in the big city, surrounded by millions of people. It's not simply having people around us. That's not what I'm talking about. I'm talking about developing those connections with another human being. We're social beings. Take a time to reach out. Don't let yourself get lonely. And of course, tired. Anxiety and stress are certainly affected by fatigue, and they also cause fatigue. People often use the term, I'm tired and wired at the same time. If you can't sleep, at least take care of yourself and lay down. And the last one, of course, and this one often gets overlooked, breathe. During times of stress and anxiety, our breathing changes. We breathe faster and more shallow. We breathe from the chest up. Take some time to remind yourself, breathe deeply through your nose, slowly out your mouth, decompress. Don't wait till you're under a lot of stress to do it. Do it when things are going well. Get into the routine. It goes an awful long way. And the last thing I want to introduce is the Therapy Online, Therapy Assistance Online program. For those of you who are listening in from Nova Scotia, I invite you to check this out. I believe the link was on the previous slide. I was not part of this development. This is licensed through, I believe, a company in Florida. The Nova Scotia Health Authority has bought a licensing agreement. Please check it out. It's very user-friendly, and they have a lot of good topics on there that certainly fit in the topics that we're talking about today.
On that note, thank you, Scott. I just want to also mention that following this webinar, we will have a resource tool and a document that will include the resources that Dr. Amaria had in the table. I know there were a couple of questions in the chat box about that, but also province-specific and Canada-wide online resource tools that we'll be sharing.
Excellent. And with that, I'm going to conclude my part of the panel. Thank you, everyone, for your very kind attention.
Thank you very much, Scott. Now we have Brooklyn Marks. Brooklyn is a graduate student from Guelph, Ontario. She is in her final year of a master's program studying counseling psychology with the intentions of becoming a registered psychotherapist upon graduation. Her personal experience living with spinal muscular atrophy, SMA, has informed her interest in supporting individuals and families as they navigate life with a disability. Brooklyn is passionate about promoting independence and wellness through meaningful connections, advocacy, education, and disability affirmative therapy. Brooklyn is also a board member of NMD United. She's here today to help support the Q&A portion of today's webinar. We have a number of questions that were sent in prior to the webinar, but I also see them coming in to our Q&A box here. You can press the hand raise button or go ahead and type your questions at this time. Brooklyn, while I go ahead and look at the questions, if you would like to have a few words, that would be great.
Yeah, sure. I just want to say that I'm really grateful to be here. I know this is a really difficult time for everyone right now, everyone. And then if you add disability into the mix, it can be even more challenging. So I'm really glad that everyone has come to talk about concerns, ask questions, and find some ways to cope during the pandemic.
Great.
So, yeah.
Thanks so much. Yeah, so we have a question here. I have an 11-year-old who has neuromuscular disease, and we were able to manage his pain and discomfort with distraction during the day, but at bedtime, he's having a hard time falling asleep due to pain and discomfort. We are diligent about his bedtime routines, warm bath, reading, massage, relaxing oils. All of these things used to work well, but he was in school and more physically fatigued, but now he's struggling with getting him to sleep. Often he'll stay awake at midnight or 1 a.m. Do you have any suggestions that we can incorporate into his routine that might help him fall asleep? We prefer not to provide pain meds, but we're open to trying anything to help him. I'll turn it to Brooklyn or any of the other panelists to help address this question.
Yeah, from a physical standpoint, I can't really comment a lot about his pain necessarily. I would look into if that is the only reason why he is sleeping at night. Right now, everything is kind of off our normal routine, and everyone's a little bit more anxious and worried, a lot of what we've talked about today. So sleep may be impacted by that. He might be stressed or anxious. So maybe opening up some conversation with him, open communication, look at if pain is the only reason he's sleeping or he's struggling to sleep, or whether there's a mental component going on as well.
Yeah, great. Dr. Amaria, did you have something to add? I see that.
Yeah, Brooklyn, I think that's a great answer. I think in addition to that, sort of two things. I think it's Janet who asked that question. She sort of answered it in her question. One of the things when kids are outside of their regular routines is they aren't expending as much energy, and we actually do have to use up our sort of reserve throughout the day to be able to sleep well at night. So I'd encourage you to get creative about the different ways your son can expend some of that energy throughout the day, whether it's challenging himself with activities, a project, anything that sort of gets the person physically active as well as kind of doing different things. And the final piece is there are plenty of pain management strategies that are non-medical. Some of the stress management strategies that can be adapted very easily for kids are the types of things we use to support kids who are experiencing, and even adults who are experiencing chronic pain. So I encourage you to look into a little bit of that and kind of brainstorm and do a bit of trial and error. One thing may work really well for a little while, and you may have to then switch it up. I think, first of all, you just need to commend yourself that you and your husband are doing such a good job of trying to give him some structure and some predictability in all this. And that's pretty incredible as well.
Thank you so much, Dr. Amaria. How about we take a question that was sent in to us? This individual has myasthenia gravis, and her myasthenia gravis is in remission. She remembers that her neurologist said that her condition can flare up by stress. She did recently lose her job as a result of COVID-19, and she's wondering about different ways she can minimize stress. There were a lot of strategies mentioned today. Anything else we'd like to mention, especially in terms of job loss?
Some things, yeah, we talked a lot about stress during, all panelists have really talked a lot about stress management. I think just to kind of echo what everyone's already suggested is just to take the time to kind of reflect on what stress you're having, what the triggers are, and then focus on both physical and cognitive relaxation strategies kind of to mitigate some of that stress, taking breaks, getting good nutrition, practicing gratitude, focusing on your strengths. All of these kind of self-care activities are something that you can focus on. From a financial standpoint, I don't have much expertise, but just acknowledging that it is a difficult time and it's okay to be stressed about that. Be kind to yourself in that way.
I should also mention that Muscular Dystrophy Canada is working on a resource tool that's explaining the different funding options available through the government in plain language, and we'll have that, of course, posted on our social media platforms once that's available. We can also go back to the Q&A. We have questions about pain management strategies for adults. I wonder if this is an opportunity actually for us to provide a follow-up resource tool. It seems that pain management and sleep is an important aspect. There's another question here about someone with SMA type 1, 15 years old. She spends a lot of time working on schoolwork on her eye gaze communication device throughout the day. And when she's not working on schoolwork, she's on social media, talking to friends. She's very limited physically. Do you have any resources or tips on how to help her stay busy and entertained during this time?
Yeah, so for sure. All of our routines are off, and it can be really challenging to get creative and find activities that are going to support us. I think it's great that you're spending a lot of time on social media with your friends. Getting that social connection right now is very important. I don't know if you're in school, Lindsay, or work, but you can always find different resources that you can use online. There's a lot of places that are taking maybe even online volunteering. There's some activities that you can do. It is very, very challenging right now, but kind of using technology, if you're limited physically, we're very good at that. We have a lot of, as a part of our strength inventory, is getting creative and finding ways to adapt in situations where you may not be able to physically be engaging in activities, but there's a lot of stuff online right now, taking a course, listening to podcasts. There's so many ways that the internet is helping us.
Right. Let's go to one of the questions that came up prior to the session. I just heard my spring convocation is going to be canceled. I feel like I worked and pushed so hard throughout my life to get to graduation. I have SMA. How do I get over being so disappointed? Does any of the panelists have any suggestions for this individual?
I can, this one really resonated with me for sure as a student. I can definitely understand where the individual is coming from. First thing, I would recognize that it's okay to be disappointed. You've worked really hard to get to this point, and it can be really upsetting that you're not able to kind of celebrate in the way that you planned. So grieving that expectation, definitely valid. But I do want to encourage you to think of other ways to celebrate. So, you know, even though it may not be what you had expected it to look like, you can celebrate your accomplishment in other ways. You could have dinner with your family. You can virtual chat with other graduates, some of your peers. You could even work on activities that kind of like making a memory book or photo book of times in your school and kind of document this section of your life. So even though it may look a little different, you can definitely still celebrate your accomplishments. And I think it's really important to. You deserve to do that. It's a big accomplishment, graduation. So
absolutely. Thanks so much, Brooklyn. Another question that we had is, I have polymyositis and agoraphobia. I feel like my agoraphobia will worsen once the lockdown restrictions are lifted. Is there anything I can do to prevent this from happening? Perhaps we can go to Dr. Kamkar. Can you speak to this about whether lockdown restrictions can enhance agoraphobia, and if you can explain what that is?
Yes, definitely. I think that, of course, if we struggle with any difficulties prior to COVID, it can definitely be that with the quarantine and self-isolations and, of course, all the added stressors and worries, everything can actually worsen. What I would say is that really focusing on what you have control over. So if, for example, there are certain things that you had done prior to the pandemic that you found helpful, are there any things that you're still able to do? So for example, it could be, are you still able to walk outside, maintaining the physical distancing? Are you still able to do things? So as much as, of course, given all the limitations that we are having right now, but anything that we are still able to engage in and have control over despite the limitations can again be tremendously beneficial. And also, as always, it's important for us to take a holistic approach to care, and again, mind-body connection. So any anxiety, any agoraphobia and everything, healthy diet, self-care, self-kindness, exercise, in addition to, as I mentioned, some of the key activities in terms of going out, in terms of maintaining our activities and functioning, can again become very, very helpful.
Great, thank you so much. I am recognizing the time. I just want to also mention that agoraphobia, in very simple terms, is the fear of public places. And so they're wondering now with the lockdown restrictions if that will be amplified. We
Just
can go
before
ahead.
you continue, there is one other question from
Right.
earlier in the event from Megan.
Go for it.
Who's asking about managing stress and concern about loved ones who are at risk and not taking the necessary precautions. I think this goes a lot with what Dr. Kamkar just discussed. Control or focusing your control, what you can control, what you do have some kind of ability to do. So even though, you're really worried about your loved one and you want to support them and you want them to stay safe, if they're not participating in the necessary precautions, focus on communicating your concern. You do have control over telling them why you're concerned, telling them that you care for them and that you want them to do the precautions, and educating them if they have trouble understanding those precautions. So focusing on that and trying your best. It's really hard to let go of what you can't control, and that it ultimately is their decision. But trying to just be put as much focus on what you can control in that situation, I think is really key to alleviating some of that stress.
Well, just end off with this one last question, as we received several individuals with the same question here, which is, I have a neuromuscular disorder and I keep washing my hands or asking my caregivers in the home to disinfect areas, wash their hands. Some of my caregivers or family members are starting to joke that my need for cleanliness has become an OCD, an obsessive compulsive behavior. Dr. Amaria or Brooklyn, any of our panelists, do you have any suggestions on this? Could this practicing hand hygiene and infection control, could it lead to an OCD, or is this appropriate given that we are in the pandemic right now?
Dr. Kamkar, do you want me to go first?
Go ahead, Dr. Amari.
Perfect, great. So I think at this point in time, there are so many different things that we can be worrying about that I would sort of say this isn't something that we need to be stressing about right now. The bottom line is we're all asked to be more vigilant, more careful. And the key piece, the difference between doing that versus being worried about OCD when you have a true intrusive sort of thought that comes in is very different. So I think the key piece is pay attention to what you're doing, do it within the realm of what other people what are the guidelines are giving to us. And I wouldn't stress about the risk for something else later on. That's kind of trying to plan for the hypothetical type of worry that doesn't yet exist, right? I think if you're feeling uncomfortable with that message that it's too much, just figure out how to communicate to that, right? You do what level, you react on a level that makes the most sense for you.
I totally echo that. Personally, I live with SMA and I'm living independently right now. And so I'm also relying on my caregivers to make sure that everything is sanitized and safe. And it can be really challenging when they kind of question your intent for doing that. And they kind of think that it's a little too much. And so definitely communicating that need to them, communicating why it's so important, and what you need from them during this time is really, really essential. For many non-disabled individuals, they obviously know that we're at risk, but they may not fully understand the gravity of it. So really communicating that and letting them know that, you're cleaning because you're scared and you're anxious, and that's totally okay. And that's something that you have control over. So they should definitely be supporting you, and hopefully if you can communicate that to them, it will help alleviate that situation.
Again, just being mindful of time, I'm going to go ahead and end today's webinar, but we will provide individualized responses to all of the questions that came in and any questions that came up through our Q&A chat box. I'd like to thank our speakers for sharing their insights, and to our mission team, Muscular Dystrophy Canada, for their ongoing support and work of supporting individuals with neuromuscular disorders using the System Navigation Program. I will be posting a top 5 key key learnings from today's webinar on our social media platforms, as well as if there were ideas about pain management resource tools and the resources that were mentioned in today's webinar. By the end of this week, you'll also receive a copy of this recorded webinar. At any time, if you have any questions, please email us at research@muscle.ca or feel free to call this number. Thank you again to all of our speakers and for all of our participants for their time during this very interesting and trying times. Thank you so much. Take care, everyone.